My name is Thien Nguyen. I'm a bariatric surgeon at Overlake Hospital, and tonight we are going to try to have a conversation about weight loss surgery and try to get in a little bit of details, but also try to answer some common questions as well. Um, Overlake Hospital has been doing bariatric surgery now for decades. I have been here since 2008. And so we have a very long history, and I've been here for a long time. And so, we provide a very comprehensive program, including medical weight loss for our patients. And so this is to go over some information, some newer information, as well as just give a chance for everyone to ask questions. So I'm going to go ahead and start. And so let's just talk about obesity first. Obesity, these days, we completely acknowledge that this is a disease. This is not an issue of personality or behavior, but it is something that is difficult and has lots of medical problems, and it requires medical treatment often. And because of excess fat and storage, there can be lifelong challenges. It tends to become more difficult with time. It can be very expensive, and finally, it is life-threatening. And so, in general, we talk about where we measure obesity based on body mass index, which is a ratio of one's weight to their height. And so, in terms of what is a healthy range, it's anything around 25 or less. And then when it is 25 to 29, that's considered overweight. And then class 1 obesity between 30 and 35, class 2, 35 to 40, and class 3 obesity greater than 40. And then in terms of our treatment options, we tend to start, of course, with lifestyle modifications, which means talking about physical activity, diet, and any kinds of behaviors that can be modified to improve calorie or reduce calorie intake and improve activity and metabolism. And then that tends to be for patients who are considered overweight or a BMI of above 25. At a BMI of 27 with other medical problems, or even a BMI of 30, then we can start considering medications. And of course, those are things like phentermine or Qsymia, but also the newer medications now called GLP-1 hormone receptor agonists. And so we're talking about names like Ozempic and Wegovy, Mounjaro, and Zepbound. And then as the weight goes higher and the BMI goes higher, then we can consider surgery. And so we'll touch on the last two here. Any questions so far? Okay.
No questions so far.
And so who is a candidate for surgery? We mentioned a BMI of over 35 with conditions like diabetes or high blood pressure, sleep apnea, or if the BMI is already at 40, even though they do not have other medical problems. They also should have attempted other ways to lose weight before surgery. They have to be healthy enough to undergo surgery and anesthesia. They meet with a multidisciplinary team, which includes dietitian, psychiatrist, nurse practitioner, myself, to review the situation, and then they're able to understand the risk of surgery and participate in the long-term care. And so instead of doing a standard presentation, I'd like to do this in a way that's a little more practical for our audience. And so these are some of the questions that I tend to hear the most when I'm meeting patients in the office. And so I'm going to try to answer these questions and fill them out with additional information. And so often the question these days, because of the success of newer medications, is what's going on with these new medications, which are called generically GLP-1 type medications. And so we'll touch on that. And then often patients will come in and also uh, want to know about the sleeve. Is it the best operation? It's the most popular operation. Is that correct? And who should have the sleeve? Um, and then another question is, why do people regain weight back after weight loss surgery? How is that even possible? So we'll touch on that. Another is, what are people able to eat after surgery? Because I think that's a big fear of folks when they are contemplating but don't want to have surgery, because they might feel like, I'm not going to be able to eat normally or enjoy eating afterwards. And then what can happen after surgery, short term and long term. So we'll talk about that. Sometimes patients think about this, but this is a very big one, which is how does insurance work? I have very good insurance, and so it should be covered, but that's not enough. We have to. We'll go into that, and then let's talk about, and then we'll talk about Overlake program specifically, and how come this program versus other programs. All right, so GLP-1, that is the glucagon-like peptide, and it is a hormone that is produced in the intestine, and it has all kinds of positive beneficial effects on the body, and things like improving diabetes and reducing hunger and so forth. It's a hormone that we have known about for decades, and there's been a lot of research on it, particularly on diabetes. It's a hormone that we also knew was increased, particularly after weight loss surgery, particularly gastric bypass. And so there's been this kind of hand-in-hand research of medication and linking back to surgery, because surgery was helping people lose weight and helping them with their diabetes and reducing heart disease risk and all these things. And so eventually, the pharmaceuticals were able to produce a compound that mimicked these hormones, and now it's called Wegovy. Wegovy is a semaglutide, and that is the medication FDA approved for weight loss. And then the counterpart, which is also semaglutide, is called Ozempic. That medication is specifically for diabetes. And then the new ones are the Mounjaro and the Zepbound. Those are tirzepatide medications, and it actually has an additional hormone effect. And so these hormones will increase insulin production, which is why it's being used for diabetes treatment. It reduces hunger, and so patients are able to not have to struggle with their hunger and craving as much after these medications. It also slows down the stomach from emptying, and so it helps with feeling full. But also, some of the side effects is that it can cause nausea, heartburn, and even things like other effects, which I'll get to next. And so, what are the things that we do worry about with these medications? Well, in certain types of thyroid cancer, this may be not safe. And so that's something that your doctor will check. Pancreatitis history, because there may be a risk of pancreatitis. There is a endocrine tumor type syndrome called MEN. And if someone has that in their family, then this is also a reason not to use the medication. And also, if a person is potentially going to get pregnant, then there may be risks with that. These medications can cause a fair amount of nausea initially in the first week or so, and that does improve over time. That's another common issue with the medication. These medicines are very effective for diabetes, and so for insurance, they will cover this medication if someone is being treated for diabetes. But most plans or companies that people work for will not cover the other version for weight loss. And so The issue is that if someone's paying out of pocket, it can cost, $400 to $1,200 a month if not covered for weight loss. And then there's a very limited supply right now, and so there's some issue of getting them for use. They tend to be a weekly injection type medication, so that's a little more convenient than every day. These medication, it's very exciting because it's helping people lose 10% of their body weight or 20%. So we're talking about 20 pounds, 30 pounds, even 50 or 60 pounds at times. And that's without having the risk of surgery and potentially even more benefits in the future with heart disease and such. And so it's very exciting, but we don't know yet really the future, which is how long will people be able to take it for, any long-term side effects. And we do know that when patients stop it, they do gain weight back. And then just to kind of tie back to surgery, this hormone is the one that particularly is increased after weight loss surgery and particularly after gastric bypass surgery. And so now we're starting to understand more how weight loss surgery is so effective. Okay, and so the next question often when patients are thinking about surgery is that, they see a lot of patients with a sleeve. And the sleeve patients, they seem to do well, and it's simpler. And since it's so common that that's the preference for most of our patients when they come in. And so it is the case that the sleeve gastric gastrectomy is a simpler operation. We are basically stapling and removing that the right side of the stomach on that picture, and leaving a skinny new stomach. It kind of looks like maybe a little banana or so. And so and we don't have to touch the intestine, which is the other tool that we use. And so there's fewer things that can go wrong. There's fewer things to worry about. And it's newer, and so it's quite popular. I would say about 7 out of 10 patients are asking or getting the sleeve in this country. And so the question is that the best? Well, it's complicated. And so the important thing about weight loss surgery is that we want it to be working 10 years later. We want it to be working even 20 years later. And that's a really high bar because, a lot of diet and exercise or even medications are only used for a few months or a few years. And as soon as it's stopped, then the results are not good. And so it's likely that with the sleeve, the long-term results will not be as good compared to the gastric bypass. We do have 10-year data, and the weight loss doesn't seem to be as good. And we want it to be working in 20 years, and we just don't know. So that's number one. Number two, about 1 in 4 patients end up having daily heartburn or reflux. And that's a common and quite bothersome condition, and sometimes can be dangerous. And so the bottom line with the sleeve is that patients have to understand that it is somewhat common that patients need another operation because of these two issues, and commonly it's converted to a gastric bypass. And so if a patient does not have heartburn, is not too heavy, and doesn't have diabetes or doesn't have severe diabetes, then I think the sleeve is a good choice. Okay. And so the next operation that we do here at Overlake, and it's what we consider the gold standard, is called the gastric bypass or the Roux-en-Y gastric bypass. This operation has been around for many decades. And so we do have lots of data on it, and we know the goods and the bads of this operation. And it uses both tools. And so instead of just doing making the stomach smaller, we also change the intestine or reroute the intestine. And so the surgery will help a person reduce their portion and feel full quicker. But also the change in the intestine, potentially reduces how much calorie a person absorbs. So that does help with some weight loss. But the important thing may be that changing the intestine also increases the GLP-1 hormone. And so just a reminder that Ozempic and Wegovy And so, patients have less hunger, less craving, their diabetes improve more. And so there are other hormones as well that are improved or modified after the surgery that seems to really help with a person's metabolic health. And with the bypass, it does seem to be very, very effective long term, 20 years out, and patients are quite satisfied and happy, and they tend to say they can eat pretty much whatever they want, but they don't have to eat much, and they tend to feel that it's the best decision that they had made and that they'd wish they had made that decision sooner. But of course, an operation is always going to have some risk, and so with the bypass, because it's a more complex operation, then there are more things we have to worry about. And so things like we worry about ulcer, we worry about low blood sugar, bowel twisting, vitamin deficiencies. And so I'll touch on that a little bit more later. So in general, that gastric bypass is better for patients who have more weight to lose, higher BMI, who are diabetic, and have heartburn or reflux, because the operation will actually get rid of it. I'm going to stop here just to remind people, if you guys have any questions, please type it in and I can try to answer them. Okay, so another common question for weight loss surgery is that what's going on with the weight regain? How is it possible? If the gastric bypass pouch is the size of an egg, if a person is only able to eat, soft, mushy foods initially, how is it possible that they can gain weight back? The answer is that, when we eat and drink calories, it comes in many different forms. And so these surgeries help with controlling portion size and foods that are dense, whereas it's not as good with other types of food that tends to go down too easily. And so, in the first 1 to 2 years, the results are great. People lose a quarter of their body weight quickly, or a third. I mean, so we're talking about like 80 pounds, 100 pounds, sometimes, even more than that in the first year. And that's because they have very little hunger, they have very little craving, they have a small stomach, and so their portions are well controlled. And, just like anything that's new, people tend to be very motivated in the first 6 months to a year. And so we find our patients exercising and just sharing all the great things they're doing, and they're just very motivated and very happy. And so we typically hear them call it their honeymoon. It's the honeymoon phase. But after that period, their life goes on, and work and stress and family, and there are other things to worry about, and there are other things that come up or that takes our attention. And so some of these things are reversed, meaning there's a little more hunger. And if a person has started snacking or drinking calories, then they'll have more cravings of that. They become a little less motivated, and of course, they're now able to eat a little more or eat more normally. And so in some ways, their stomach has stretched a little bit. The other factors are, their stress can change a person's habit and eating, and how they cope with stress in terms of eating snacks and drinking calories. Staying up late is a common issue. People get tired, but then they may be hungry, and then they'll eat late at night. They're exercising less, they're less motivated. And so in the end, some old habits come back, and that will lead to some weight regain. And so this is just to reiterate, the surgery is not great at preventing snacking or grazing or drinking calories. And these kinds of activities, they tend to be high in fat or sugar, sweets or salty snacks, and that triggers more craving and more hunger, and that just kind of adds to the fire of it. And so it's really important to know that weight loss surgery only reduces the meal size, but not the number of meals, meaning the number of snacks. And so it's it's still possible to end up eating too much calories. The things that also happen that lead to weight loss, but then potentially will lead to weight gain, is that GLP-1 hormones initially go up, which is a good thing. And that helps with hunger and reducing craving and diabetes. But then over time, it can decrease, after weight loss surgery, which is kind of like taking away the medication in some patients. And certain, the bypass may be a little better versus the sleeve, not as good in terms of that hormone. And so it's important to stay motivated. That's really important. Staying motivated allows people to make good choices and exercise and be aware of what they're eating. And so it's kind of there's no exercise can be motivating. Being part of a support group or can be motivating. And then following up with a specialist so that we can keep an eye on things. So that can also help motivate people as well. And then following up with us is important because we now have the opportunity potentially to prescribe these newer medications to help with more weight loss. Okay, so the next question, a common question, is eating after weight loss surgery. Often the concern is that they're not going to be able to eat and enjoy eating, and a lot of foods will be off limits. And so we sometimes see kind of this last meal in patients who are about to have surgery, where they end up right before surgery gaining some weight because they're worried or they're trying to have a last hurrah a little bit. The reality is that most patients say long term they're able to eat pretty much whatever they want. Not that it's eating very large amounts, but if they want to eat healthy and then they can. If they decide to eat unhealthy foods, they can. But it still works because the portions are smaller. And so between the sleeve and the bypass, the sleeve stomach may be a little larger. And so we may see patients say that they're able to eat more after a sleeve compared to a bypass. The stomach does stretch, and it's supposed to happen. And because if it didn't, then you might end up just continuing to eat like a baby. Excuse me for a second. I'm sorry. But patients don't stay eating mushy or soups forever because that wouldn't be the goal of these surgeries. And also, the stomach may stretch so that people can eat normal foods, but often people will say it's because they were drinking carbonated drinks or eating particular kinds of food, so they're told to avoid certain things. And I try to push back on that a little bit. It's not that these things cause the stomach to stretch, but just in general, the stomach does stretch out a little bit. And so there are a couple things I think after weight loss surgery that is maybe relevant. Overeating all the time, ignoring that full feeling, maybe that could potentially overstretch the stomach. But really the thing to focus on is that weight gain is from higher calories, and that tends to come from snacking and grazing or drinking calories. And so our patients and most will start out with soups and then move on to soft, frequent meals in the first 3 months after surgery. And then after that, they are able to start eating normal foods just in small amounts. And in the long run, the goal really is to try to have 2 to 3 meals a day and have all the calories come from those 2 or 3 meals a day versus, the regular meals and then snacks and then drinking calories. And so, and as I said before, a lot of patients will say at a year that when I ask them what are they eating, they say, "Doctor, I can eat pretty much whatever I want," and they kind of say that little bit sheepishly. But they do say that they don't have to eat as much, and so they're very happy with being able to enjoy food, but just have that nice that control as well in terms of portions. Um, okay. And so, what are some specific complications that can occur after a sleeve or a gastric bypass? And I tend to tell patients that it's not a simple answer because with the sleeve, I tend to worry about two major things, and it's a simpler operation. And then with the bypass, even though it works better long term, there's more things to worry about. And so the important thing to remember is that the risk of serious complications right after surgery is quite low. Even though it's a major operation, it's more like some of the smaller operations that we do because we're able to do it quickly through little incisions, laparoscopic, and so the healing is quicker, there's less bleeding, and so forth. And so we touched on this a little bit. With the sleeve, 1 in 4 patients end up having to take heartburn medications every day. And so that's an important thing to remember. If someone already has heartburn and struggling with it, then the sleeve may not be the best choice. And then the second thing with the sleeve is that just to be aware that it is somewhat common to need another operation after a sleeve, whether it's for bad heartburn or not enough weight loss. The next operation, the gastric bypass, though it has a lot of good long-term data, one of the things that can happen is something called dumping syndrome after gastric bypass. That's a common term that people will hear, and it means different things to different people. But specifically, it's about eating when a person eats too much sugar. So whether it could be a dessert or drinking a juice even, or Starbucks or a soda, the sugar will go very high in the bloodstream very quickly. And then the body will bring that down by producing insulin. But sometimes the pancreas will produce too much insulin. And then once the sugar has gotten to a normal level, it keeps going down. And if it keeps going down, then a person might actually pass out or even have a seizure driving a car. And they often also will have heart palpitations and sweating and just feeling terrible or feeling very tired and sleepy. And so the thing to do is just to limit how much sugar a person has after these surgeries. Another issue after gastric bypass is that there is an increased risk of ulcers in the new stomach, but it's particularly because someone has resumed nicotine or smoking, or they're taking ibuprofen for weeks and not taking breaks. And then there's some other things that can cause ulcers, but it is something that is more common after gastric bypass. The third thing is that there can be a deficiency in iron or vitamin D and some other things, protein, because of the bypass. And so a patient really needs to take their supplements every day and come back and see us every year to have blood work checked and make sure the vitamins are appropriate and adequate. The fourth concern after bypass, you got two more, is that because we're changing the intestine, there is a small risk that the bowels can get twisted. And that risk is, again, just a few percent, but it is a lifelong risk. And if it does happen, then the patient needs to have surgery to fix it. And then the final thing that is somewhat common or an issue is that because the stomach and intestine anatomy has been changed, it prevents us from being able to put a camera down from the mouth and look at the second stomach, the other bigger stomach, or the duodenum, or the bile duct. And so that's a rare thing that we need to do, and it can be done, but it's just more challenging after having gastric bypass. All right, so we're kind of past halfway. Another common question is insurances. And so patients hear from their doctor and their research that they qualify, they medically need weight loss surgery. And so if it's medically necessary and their doctor says they need it, then the insurance should pay for it. Normally, that would be true if someone had high blood pressure or diabetes or was told they had cancer. There would be no moral or ethical reason for insurances to say no. Unfortunately, in this state, the illness of obesity, it's not given the same set of rights, and so it's not required by our state government that it be covered. And so it does come down to who that person works for, and not which insurance they have. So for patients who are going through insurance, we see them coming from a few large companies like Microsoft or Amazon or Costco. Certain unions who are national and very well organized and has big deep pockets. Often that's included in their benefit. A lot of state or county positions and jobs, employees have the benefit. And if a patient is on Medicare or Medicaid, that's also included. It is covered, and then also TRICARE. And then, I think this is for me and for us to brag a little bit. I think when patients come to us, they've kind of made their decision already. But what's special about Overlake? I'll just touch on the insurance part first. Unfortunately, insurances also have their own requirements. Aetna has a requirement that the hospital meet the standard called Institute of Quality. Regents Blue Cross Blue Shield has a requirement that they are a Blue Distinction hospital. Optum Insurance calls it Center of Excellence, and so not every hospital has these things, and so we do see a lot of patients coming from other places because they discover that it wouldn't be covered there, and so it's really important, unfortunately, that a hospital like us meets all of these criteria, which we do. Another reason for Overlake is that there, besides just insurance, there is we want to be really good at what we do, have really good outcomes and volume, and that for us is represented by health grades, which measures hundreds, if not thousands, of hospitals across the country, and they're given a rating, and we've been a 5-star for many years now, and we're the longest running 5-star hospital in the state still. And then also we're a MBSA QIP facility accredited center, and that's required by Medicare. And so those are kind of the more practical things that are special about our program. We are a comprehensive program, meaning we have all the components that are needed to get our patients prepared and to help them long term. And we have a very experienced team. We've been doing this now, the same group of people now for many years, and I've been here since 2008. We offer monthly support groups. We have a Facebook group that just helps with the sort of the emotional, mental side of weight loss surgery. And so this is just some links here for our support group. It's offered twice a month. Our dietitian and our nurse, registered nurse, help support this group, and it's free, and it's you can register here. So weight loss surgery, it's more than weight loss surgery. It's ultimately, we're doing something to improve a person's health and quality of life and help them live longer. Often it's thought about as some kind of cosmetic surgery, but really this is not any different than your family doctor prescribing medications and working with you over the years to improve your health. And this turns out to be the most effective way to help a person of size who has a lot of weight to lose to improve these things. And so this is a short list, or a list of all the conditions that a person who has a lot of weight would be suffering from, and what happens to them after weight loss surgery. And so, things like the diabetes, about 83% of diabetics will see their diabetes go away, or certainly improve. Heart disease, 82% risk reduction. High blood pressure, up to 90-some% go into remission. Sleep apnea, quality of life, the risk of dying is reduced by 89%. The risk of dying from cancer is reduced up to 75%. And so we're really excited and passionate about this kind of therapy because of these results. And this is our contact information. And I want to thank everyone for their time. And if there's any questions, reach out to us, let us know. We're very helpful. We've been doing this for a long time, and so we will be able to answer any questions you have. I'll stop there for a second here. Any questions, Carmela?
No, there's no questions in the chat. If you have any questions, please feel free to just type them in the chat and we'll be happy to answer them. But so far, nothing.
I have also enabled everybody's mic, so if you'd like to unmute yourself and ask a question, please feel free to do so.
So we do have a question. It says, have you found people who have regretted the surgery?
There are times when a patient is having complications that for that period of time, they question why they did it. And so complications might be, strictures or ulcers, or dumping syndrome, where they're having trouble with low blood sugar. And then, after a few months or so, those patients tend to get better and the problem is figured out, and then they are happy. They are able to move on and just see the benefits of weight loss surgery. And then there's the rare patient that has complications that don't get better. And of course, those patients do sometimes regret having had the surgery. But, those are pretty rare, where a patient has a serious complication that lasts for a year or so. In general, patients generally say, they're really happy that they did it and that they wish they had done it sooner. But good question.
We also have a question. She says, since I've never been to Overlake, is there parking? Is it free?
There is parking. It's pretty easy. We're not like a big city with terrible parking. And in clinic, I have to remember whether or not there may be a bit of a charge for parking after like an hour or two or something like that. But the parking is really close to the offices, and there's lots of parking.
The next question is, Kaiser wasn't mentioned. How does that compare to your program?
It's a very good program. The program is very similar in structure, and because they also operate at Overlake, we have just very similar processes, and we work as a group. The surgeons, the advanced practitioners, our dietitians, all the team, they work together, and particularly we have Carmela, who's our program manager, that helps to kind of tie everything together. It's very collaborative, and we, the Kaiser patients have to go see Kaiser surgeons, so we rarely will see patients with Kaiser insurance, and so when they have their own seminars and their own information, and so we're not speaking for them just because they're separate in terms of insurance.
Another question is, I'm curious if the surgery impacts core strength permanently, as in ability to do aerobic and anaerobic exercise, example, circuit training. Just curious if muscles are affected in any way.
Yeah, it's a great question. So, the weight loss surgery will make a person have better mobility, better endurance, just be able to do more things. Our patients talk about being able to, strength train or run marathons or do triathlons, do STPs. I'm not encouraging some of these things because those are some of these are kind of extreme. But it is in general across the board better for a person's physical health and exercise. The one thing I do hear is that a person's strength in terms of doing certain things that require a lot of strength, that may be a little less. And so I've heard patients who ride their 900-pound motorcycle say that it's a little harder to move the motorcycle. And it's kind of understandable because a person who weighs 300 pounds, they have a lot of muscle to move their body, and also that means they're able to move heavier things. But if they lose 100 pounds, then at least the muscle mass itself is going to be a little less. And then the core, that part, it should also be easier and better, and just be able to do more things with core exercises and core strength.
Another question is, you mentioned dumping syndrome. What are the physical effects of this?
Sure. And this is, again, just a reminder, it's when a patient eats or drinks something that has a lot of sugar. And initially they may not feel much, but then after, 10, 20 minutes, they may start feeling flushed. I mean, their face gets red and they're sweating, and then their heart's pounding and they're just feeling nauseated. And then more time, they may have diarrhea, some abdominal cramping. And then as the sugar starts to go low, then, they may become just really anxious and just really sleepy, or have to lay down, and they maybe actually become confused. And so the symptoms may be minimal, or it may go through all that and last for an hour or hour and a half. But it is avoidable.
Another question is, I have a hip implant and fused back. Would that disqualify me?
No, not those things in particular. The things that we worry about when we take patients to surgery are, if someone has really severe heart failure or really severe lung disease, if they have severe liver disease, if they're very weak, they're immobile, or they're not really able, to do anything except using wheelchair, the risks are going to be a little higher as well. certain heart conditions like severe pulmonary hypertension. Those are the things that that can prevent them from having surgery.
There are no further questions in the chat.
All right. Well, thank you again, everyone, for those questions and your time. And hope you guys have a good night. And if there's any additional questions, just you can just come to the Overlake Hospital website, and you should be able to find us. So, thank you and good night.